Good evening and a very warm welcome to the first Wednesday webinar of 2021. When we started these webinars back in the middle of June, I think hopefully we would have thought that maybe life from a restrictions point of view would be slightly easier. Sadly, they're not, but we live in hope that very soon we'll be able to get out to be able to enjoy the countryside and our horses so much more. We're just waiting. Thank you very much for joining us by Zoom this evening. As you know, if you've joined us before by Zoom, you can get involved in the poll questions that we've got this evening, and also in the ask questions directly through the Q&A function. We're just marking time slightly to wait for our Facebook viewers to join us, and then we can get going. But thank you very much for joining us. Just from the Zoom perspective, if you've got just a chat comment to make, then please do use the chat function. But if you do have any questions, then please do. It's so much easier if you can put them in the Q&A function at the bottom of the screen. Good evening and welcome to those who are joining us on Facebook this evening for the first Wednesday webinar of 2021. We're delighted to have you with us, and we're delighted to welcome Professor Derek Knottenbelt, who is a renowned practitioner in equine medicine, and also World Welfare's Chief Field Officer, Claire Gordon. We're delighted to have you with us. We really want this to be an interactive event. So please, if you are joining us by Facebook, then please share the live video. We do record all of these webinars, so they'll be available afterwards, as well as all the previous webinars we've done. If the topic tonight is of interest and spurs you to think about other topics that you think we should be discussing during our webinars, then please do send through your suggestions to education@worldhorsewelfare.org. We're going to have two presentations tonight, firstly from Derek, and then a briefer one from Claire, and then we will open it up to Q&A. So please, we really want to hear your questions. We'll get through as many of them as we can. So if you're on Facebook, please use the comments function. If you're on Zoom, then please use the Q&A function at the bottom of the screen. So before we go any further, we have got a very quick, I'm going to share my screen with you. We've got a very quick poll question for you. Now, as I said, if you're on Zoom, you'll be able to answer this. My screen seems to have frozen. So let me here we go. How frequently do the horses you care for have a skin condition? Now, I know from a research perspective, we've got probably a slightly biased audience, since the topic of this evening's discussion is all around the skin. But no right or wrong answer. Just want to get a feel for who we've got joining us for the webinar today. So whilst you're completing that, I'm just going to tell you a very little bit about World Horse Welfare. Seems to be very slow this evening. World Horse Welfare is a charity that was founded on supporting the horse-human partnership, and that's very much what we still do today. Through our 4 rescue and rehoming centres in the UK, through our campaigning work across Europe, to the work we do in 16 countries across the globe. Now, clearly, what our work, like everyone else's, has been fundamentally impacted by the pandemic, which is why technology has played such an important part, an even more important part than it has previously. And that's why tonight's webinar is such a good way of getting educational messages to help us as horse owners. And that's really what these webinars are all about, practical ways to help us as horse owners take better care for our horses. Now, tonight's topic is all about skin, how we can recognise, manage and prevent some of the most common skin conditions. And in 2018, a national survey of the UK horse health put skin conditions as the most common condition that people had to deal with. And in fact, 1/3 of all problems reported in the survey related to the skin. So it couldn't be better that we are focusing on that this evening. Before I introduce our first speaker, we'll just have a quick feedback on that first poll question, which hopefully Basil will be able to put up for us now. And so the majority have occasionally had to deal with a skin condition. almost 10% have always had to deal with the skin condition. So you're certainly in good company, and I really hope that tonight's webinar, I'm sure it will provide a lot of support and guidance for us all. So now I'm going to introduce Derek, who obviously needs no introduction. Originally born in Zimbabwe, qualified from Edinburgh Vet School, a lifetime of as vet, hugely renowned vet, spent most of his time at Liverpool Vet School. Some of you might not know that Derek actually founded Vets with Horsepower, which is an initiative that he started back in 2009, and where a bunch of vets on motorbikes go around initially the nation, now the world, and provide CPD lectures to veterinary students around the world. It's an extraordinary condition. And in that time, and they would have done the 10th Vets of Horsepower tour last year, but for the pandemic, they have raised over £750,000. As Josh Slater says, who's one of the Vets with Horsepower, he is a force to be reckoned with, Derek, and he most certainly is. He's the type of person, if we didn't have travel restrictions, would be other side of the pond, potentially at an inauguration that's just gone on. So he's a real superstar. And without further ado, Derek, over to you.
Well, thank you very much, Rowley. And if I just share my screen, I think I have to do that, and then just go to this, and then hopefully you'll get my screen here. So share. Sorry, it's just slightly slow here for me, for some reason or another. I don't know oh yeah, can you, I hope you've got that now. Thank you very much. Thanks for your patience there a minute. Just takes a second or two to get that sorted. Thank you very much for your very kind introduction, and thank you again for inviting me here to do this evening. Great fun with these kind of things, and I strongly believe in the sharing of information. There's nothing that owners should not be told, nothing that owners should not tell us either. So it's a two-way stream, and I hope that some of the things we're going to come up with tonight will help a little bit. Now, we can't deal with everything, but we are going to deal with some of the most important conditions. First of all, thanks to all of you guys out there, colleagues in Horsepower. Just wish you all to keep safe, keep well, and do the right thing by your neighbors, by your friends, by the country, by the world. So look after yourselves, look after everything. So thank you all, my great friends in the horse world. So the first thing, of course, is to remember that the skin can only respond to insults in a very limited number of ways. The early recognition is always best. You really have to be able to recognize the condition, and the earlier you recognize it, the better chance there is. And what we're trying to persuade everyone is that, above all, do no harm. So if you can't do good, then above all, you should do no harm. And remember that the skin wants to be healthy, doesn't want to be sick. It wants to heal, it wants to get ready, it wants to fix any damage, any inflammation, wants to be right, it wants to be healthy. So, and all management must be directed at the cause of disease. So you'll see why that's important in a little while, because if you find the cause of the disease and you address the cause, it's a really big step, as opposed to just dealing with the symptoms and then saying, well, my horse is itchy, I'll give it some steroid and stop it from itching. But actually, if you address the fundamental issue to the disease, you will solve the problem very much easier and very much more thoroughly, and usually with much less danger to the horse. So the important thing in terms of prevention, as a general principle, is to make sure that your management is adjusted to minimize the risk of skin disease. And obviously, you can imagine skin disease includes trauma, of course. So if you don't fix your fences and have barbed wire hanging around in the field, you're asking for trouble, and you will get it for sure, because horses wake up in the morning and wonder what kind of veterinary challenge they can offer today. And that seems to me how they function. And hygiene and common sense are really fundamental. And that's very pertinent even now for all of us. Hygiene is an issue, and common sense is an issue. And the two things need to go hand in hand. So the skin is by far the biggest organ of the body. Not many people realize that, but it's the most visible and accessible body system. You can see it from the outside. You don't have to go hunting with your arm up the backside of a horse to go and find it. It's there, ready to be seen. And the skin is adapted to form different structures and features: the hoof capsule, the eyelids, the cornea, even the ergots and chestnuts, the mane and the tail, all these kind of different structures that comprise the skin. And we tend to think of them all in different ways, but they're actually just skin modified. So the hoof is just modified skin. It's like a nail, if you will, on your finger. The skin has a lot of functions. We just think of it as being something pretty on the outside, with it covered in hair. But actually, it has all sorts of immunological properties protecting us from the outside world. That's why we wash our hands when we're in COVID circumstances. We should be washing our hands anyway, come to that. There's a physical barrier. It acts as a physical barrier, an immunological barrier, a waterproofing barrier. It thermoregulates and makes vitamin D. That's just a few of the countless structures and functions of the skin that we have to remember take part. And so if we have any inflammation, then we're bound to affect some or other of these functions. And here, just some pictures of normal skin. And you can see these are some of the normal structures that we all look at every day. And we should remember that actually, when we see damage, it's usually very subtle to start with, very small, very subtle. Now, the reason I've put this picture up here is you can see a little exudate coming out of this skin here. Do you see that? That's the first sign of something going wrong. And if you pick it up then, you can deal with it very quickly. Same with this. If you see that this leg looks normal, but look at the hoof capsule. It's not normal. You see? So there's something going wrong here. And we can say that this has been 4 months since where whatever it was started to go wrong. So we can ask, hang on a minute, what went wrong 4 months ago? Oh, we changed the food to such and such a hay source or such and such a circumstance. And they say, oh, hang on a minute, there's something going wrong. There's a little keys that you can get that might help you just a little bit. And of course, there are lots of different things that we use on the hair. We use them for identification, a prophet's thumbprint, for example, and then these curly coated sorts of things that we get here. And of course, we influence the skin ourselves by putting some freeze brands on them. But of course, colors and all sorts of things and shapes and the whorls and the hair coat density all vary according to the different stages of the horse. I'm not going to go through this, but it's a matter of logic. But if we don't get the data from you guys out there, we can't get the solutions. We have to work towards finding solutions, and this means we have to go through the process. So I'm asking everyone to always provide your vet with all the information you have available. If you've tried to treat something and it's failed, don't hide it. Tell the vet. We're not going to criticize you at all. We're going to try to learn from that. And whenever someone says that to me, I'll say, did it work? They say, well, it worked at the beginning, but it didn't work after that. That's telling me something. It's giving me information that I can get much better at doing. So we need this cooperation between us, not a competition to see who can bamboozle each other the most. So as I said before, if we treat the symptoms and the signs, we don't solve the problem. And you may say, what's Mungo Park got to do with it? He was a Scottish explorer in Africa. And he said, if you know the cause, the treatment becomes understandable. In fact, he said, if you find the cause and remove it, the itch will go away. He was talking about itchy on himself as well as on his people that were traveling with him. They all had itches. And he said, well, if you don't find the cause, then it's no good. You've got to find the cause and remove it. So remember, if more than one horse has the same signs, the likelihood is that the cause is an infection or an infestation, mites and lice and all sorts of things, or that the same management or toxicity is being applied to all the animals. So if we have one horse with the disease, that's important for the horse, of course. But if we have a stable which has got 6 similar cases that develop over a week, and I'll come back to some of those conditions later, we usually ascribe them to infections. So let's just discuss the big 5 or 6. Now, I come from Africa, and the big 5 is the rhinoceros, the lion, the elephant, the buffalo, and the leopard. Those are the big 5. But as far as the skin is concerned, it's infections, allergies, sarcoid, melanoma, and carcinoma. Those are the big 5 that we are really concerned about. But there are lots of others. Just like there are lots of other African animals in the world, in any case. So there are lots of other conditions, and we can perhaps discuss some of those in the questions if you've got bits of questions about any of the others. But we'll go through some of these. So looking at the viral diseases first, we know that young foals and young horses, usually under the age of 2 in their first year at grass, commonly get these grass warts. Now, these are similar to the human juvenile warts that kids get. We all get them, a bit of verrucas, a bit of warts and stuff like this, it's okay. But they spontaneously resolve. You can see that this is how it starts, then it goes to this, then it goes to this. And that just resolves on their own. They don't need any treatment. It's a very interesting condition because they never get it again. However, a similar virus causes these ear plaques, which occur inside the ears, which you can see here. And you can see these are very much more difficult. But actually, we always used to call them fungal plaques or ear plaques. But actually, they're not restricted to the ears because a similar condition occurs in the sheath of geldings like this, and sometimes on the medial thigh, the inside thighs of young geldings in particular. Why it's geldings, of course, that's the smell of the sheath and the smell of the ear tend to attract the vectors, the flies, which bring the virus. Very difficult disease to deal with. Be very careful because some of them are very sore and the horses become resentful. And then, of course, if you start fiddling with them, they become more and more and more resentful and more dangerous. Then there are some adult onset warts. These are just standard warts, rather similar to this, that develop in older horses, sometimes on the leg, sometimes in the face, just individual wart-like lesions, which are genuine papilloma or warts. And you may say, well, why is that important? Well, I've just put this picture here to show you. This horse had these little lesions inside the ear, which are very typical. Then it had this down here. And this just shows the concept of comorbidity. In other words, more than one condition. Here are the plaques, the ear plaques, and here's a sarcoid. Of course, now the temptation is to say that they belong to the same circumstance. Well, they're quite different conditions, but they may have developed under the same driving forces. So it's important to remember this. And of course, whenever you see this, just be careful, consult your vet very carefully with this. So these things are generally easily recognized, but they're not always painless. There's not much confusion with other conditions. But just beware of the sarcoid. Here's these adult ones, which I told you about. These are very severely affected young horses, you can see. And the owner was very distressed. Horse was slightly distressed as well because it was cracking and bleeding all the time. But actually, within a few months, the condition started to improve and then it got better. So the best way of dealing with these conditions, including the ear ones, are leave them alone. You know, they're best left alone unless your vet advises you to the contrary. For prevention, hygiene. Again, remember hygiene, and that's an important issue, but it's really problematic. How do you stop the virus from being on the pasture? You know, it's very difficult. You know, we have difficulty keeping viruses out of our own lives at the moment. But nevertheless, I think if you have a pasture where every single horse develops it, try to leave the horses out of that, young horses out of that pasture until later on in the season, so that it's not an early challenge, so the sun has had a chance onto it to kill the viruses and so on and so forth. It's quite an interesting set of conditions which deserve to be considered, actually. Bacterial skin diseases are common. I've just put a strangles case up here for you just to remind you that strangles causes abscesses and abscesses burst out on the skin, either underneath here or elsewhere, come to that. But mud fever, rain scald, paston dermatitis, that's a really common and very serious condition. And coupled with that, we usually want to discuss this saddle rash, staphylococcal dermatitis and stuff like that, because this is a hideous condition which arises purely and simply as a result of poor hygiene principles. So you've got to make sure that your hygiene is good. So here you see this hideously painful, whereas mud fever is not so painful, but it does cause quite a lot of damage in different parts of the body. So mud fever and rain scald is a very common problem. But whenever we talk about mud fever, I thought some years ago that I would set up and find out how many conditions, primary conditions, remember the cause, not the effect, but the cause. How many the diseases could be associated with mud fever, the so-called mud fever? And I found 38 different skin conditions. Of course, some very rare, some less rare, some very serious, some less serious. Okay, so it's not just as simple as that. The bacterial infection that we commonly deal with is dermatophilus. And that's a bug which sits on the skin. It only goes into damaged skin, wet, macerated soggy skin. So it tends to be along the back, it tends to be on the legs. And this is the kind of thing that you see. So you pull the hair out and you get this sort of a rosy circular area. Can be mistaken for ringworm, I have to say, but on the legs like this. Uncomfortable, not hideously painful. The moment they're painful, then it's something else. Be careful. This is a summer form. This is the winter form, as you can see here. So as you can see, this is along the back. You see along here, over the shoulders and over the head. Here's on the back, in the back. Here's on the legs. Here's some local areas. But of course, sometimes long-standing chronic changes that are much more difficult to ascribe to the same thing. So all these conditions here that you see are all the same disease. Management and prevention, there's our hygiene, rugs, brushes, saddles, washing them, hygienic preparation, warm water washes, cold water washes, not good. Don't wash your horses therapeutically in cold water ever, please. It's warm water or warm to hot water, actually. It'll be much better for you. Antiseptic washes, don't use rubbish such as fairy liquid and all sorts of stuff like this. You don't bath in fairy liquid. I'm sure you don't. It's very good for COVID, by the way, just as an aside, but that's another issue. You dry the skin carefully afterwards and protect it from wetting. Remember, sun is good, rain and wetting is bad. It's highly contagious, so be careful not to spread it from horse to horse. Hygiene, more and more and more hygiene. Hygiene, 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 and hygiene is the order of the day for this condition. Ringworm. Ringworm is an interesting disorder of horses. It's a fungal disease, and you can see why it's important because it is a zoonosis. It affects people and their skin. So if your horse has got ringworm, or you even think it's got ringworm, please don't go scratching your head or scratching some other part of your anatomy that you may regret later, because the spores can be on your hand, and ringworm spores need skin damage. They don't go on normal skin. So you can see they're commonly associated with girth areas, tack areas, areas where things are in contact. It could cause minor and more extensive skin trauma. They start out as very small circular areas, and they widen out, they spread. So this is the classic example here. And this is how they get when they get this so-called girth itch. Girth itch gives it a nice name. I call it ringworm. And ringworm is not a good thing to have. It's hard to get rid of in stables. They found the spores of the ringworm were still viable in Tutankhamun's coffin. So they can last that long. You can't get rid of it. What you can do is you can hygiene manage it. So remember that you have to establish where it's come from. Where did it come from in the first instance? Try to catch it early, make a very aggressive approach to it if you can, so that you can start to make some sensible judgment about how you're going to control the disease. So there are cat forms, dog forms, rodent forms, cattle forms, and other horse forms. So if you know where it's coming from, you can get a good idea of how it's come into you. Here's a donkey with one. I just thought I'd put up a donkey because they're special little creatures, as we all know. The management and prevention, it's not okay. This kind of thing is not okay. Combining brushes in a pack here, this kind of thing is bad because you pick up a brush, you rub the horse, you groom the horse, then you put it back in there. It's got a few ringworm spores, then the next stable gets it, then the next one, the next one, the next one. Remember what we said? If more than one horse gets it, it's a common infection or a common management process or both, or a common toxicity. And toxicities are rare, so that leaves you with just the two options. And it's important to remember that. So prevention, firstly, you got to get rid of the disease. You've got to get rid of the disease on the horse. That's important. And you've got to make sure that the spores are disposed. Now that's quite difficult because you have different kinds of disinfectants and so on that are more liable to produce a killing out of the spores, but you can't get rid of them completely, no matter how hard you try. So once it's in your stable, just be aware. The important point is to detect it early and treat it hard, because once the horse has had it, it's more or less immune, at least for some years after most infections. Prevention, therefore, is just a matter of hygiene, and it's vital. It's a very important thing. So if your horse has this, it's important to remember that hygiene has to be instituted in your stable yard. It's a zoonotic disease. So remember this, it's one of the few diseases that can spread from horses to humans. Not easily for the horse forms, I agree, but it can do. And furthermore, it's important to remember that the animals spread it to the horses, including the humans. So people with ringworm on their dog or their cattle then go and handle the horse gets the ringworm. And we can recognize where this has come from. We can work it out from the type of ringworm that's there. So remember this, it's just not worth, it's not worth taking the chance on horse ringworm with yourself. So if your horse has got ringworm, gloves, hand washing, tack cleaning, tack sterilizing, sterilize the brushes and so on and so forth. Very important management process. Then we come to some parasitic diseases. Now, parasitic diseases are usually itchy. So I'll show you this little bit of a comical picture here. This little mini Shetland. You can see it's a little full. It's only 5 months old, and actually it was younger than that, I think. But he's got obviously a little bit of an itch, and you can see he's loving this, rubbing his bum, and he's loving every minute of it. Look, this horse, on the other hand, has got a different kind of an itch, and this itchiness is a very common presentation, and it frustrates a lot of owners when their horses itch. It's important to remember that whilst not every horse that itches has parasites, either oxyurus pinworm infection or lice or mites, for example, not everyone has that. But of those that itch, a very high proportion do have it. So probably about 90% of itchy horses have parasites. So when the vet comes out, we usually say, let's get rid of the parasite option first. So that's the first thing to do. By looking at these two, we wouldn't necessarily be associated with lice or mites in either of these two cases because we know what these diseases are. Lice are visible, mites are not visible. So if you look on the rug, you can't see the parasites, maybe it's mites. If it's visible, then you see the lice, and we'll show you some pictures of that in a moment. These are the little guys again. So this is the lice, and I'll play the video for you just to show you what they look like. And you can see this is, if this was running around in your hair, you would know this is the lice that kids get. It's not the same parasite, of course, but it's the horse louse, and you can see why it's important to detect them. It happens mostly in congregated horses in winter months, commonly with horses that are in a little bit of mediocre condition or in very poor condition. The itchiness is mild only, and it gives them with a moth-eaten kind of appearance. The horse itches a little bit, and then he moves away, and then he itches a little bit more. It's not a terrifying, itchy process. It just has that persistent, mild, static itch that goes on and on and on. And when you take the rugs off these horses, if you take the rug off very quickly, turn it up on its back, you'll see the parasites, usually lice. You'll see them. They'll be very visible. There are two kinds of lice, some that suck blood, dangerous ones. We don't see many of those in UK. We do see them, but they're not common. And those which eat on the surface of the skin. And those are much more difficult because it's harder to get medication at them. From if you were to give them a wormer like ivermectin, for example, it doesn't really get rid of them effectively enough. Treatment's not always easy. You've got powders and washes and all sorts of things that you can use. Mostly the powders suffocate them. They don't seem to kill them very much, but they suffocate them. And so they can't breathe with too much powder, and that kills them, or at least reduces the odds. So the anti-parasitic medication is very poor these days. Mites, on the other hand, cause a different set of syndromes, and you can understand some of these. These are the more characteristic things of the leg mites, the Coreoptes leg itch, as it is. And you can see these horses, this one's been clipped out, this one hasn't been clipped out, but you can see that they chew at themselves, they bite at themselves, and of course they have parasites. And when you look under the microscope at these parasites, you can see that these are very tiny parasites by comparison. So you can see, here's this little guy here, look, you see him here, and this is how they look. But of course, whilst that one goes on, you can see there's millions of them here. These are under a microscope, and you can see these ones rushing about in here, which I've groomed into a little bottle. And this is me looking with my microscope at the bottle. So you can see that is enough to make anything itch, I would suggest. So the reality is that whilst we all look at these parasites, mostly they're Coreoptes, as we know, but there are other things such as poultry mites, for example. So if the horses live with poultry in the yard, be careful of this parasite because it causes very great damage in horses. Heavy itching this time, site located response. In other words, if they itch the legs, that's where the parasites are. So it's not like lice which move around and bite here and a little bit itch here and there. It's much more extensive than this. The legs are most often affected, but please remember that this condition is not restricted to feathered horses. There's a complete fallacy, I'm afraid. Feathered horses have more, I agree, but it is not restricted to them. And so quite commonly you find that people want to treat the feathered horses, but they forget the next door horse that doesn't have feather, that is probably got a few mites on it, that doesn't itch very much. And of course, it can easily spread from stable to stable, very, very easily, on your boots, on your things, by the eggs, going from one stable to the other. Mostly grazing horses in the summer lose them, but there are carrier horses that carry it right the way through. So if one horse in the stable yard shows this condition, you should consider at least treating the whole lot. I know it seems a lot, but actually, unless you do that, you're going to be persistently treating the condition. Probably will anyway, but it's not a nice condition to have to deal with. It's a characteristic itching pattern, but be careful. So this horse was itching at itself. And this horse, as you can see here, I'll just turn the volume off. You can see this horse was itching here very typically. But of course, we found that this was not. This was actually a life-threatening disease called sarcoidosis or multisystemic eosinophilic epitheliotropic disease. It's a life-threatening disease. It's not a parasite. You can treat that for parasites till the cows come home. It doesn't do any good. Remember, however, that it's mostly a winter and spring condition in stabled horses. Always consult your vet with this, because you need to understand that you need to treat all horses. And of course, you need to treat for carrier horses over the summer, and you need to treat the stables at the end of winter, and again, probably at the beginning of the autumn when the horses are coming in, so that you give the horses the best possible chance of preventing the infection from developing. So what about immune diseases? We got to crack on a little bit.
5 minutes to go, Derek.
Yeah, thank you very much. Immunologic diseases, allergy, sweet itch is the commonest of these. But of course, hives are important. You can see here that you can have horses with sweet itch that rub themselves like this. It's a very, very common disorder. But if you're allergic to something, what do you do for yourself? If you're allergic to strawberries, what do you do? Well, you don't eat strawberries. It's as simple as that. So since these horses are allergic to midges, they must just avoid midges. I can hear you all say, ha, 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 how do you do that? Especially as I live in Scotland. Half the midges in the world live in Scotland, and the other half live in the north of England, as far as I can see. But it gets worse year on year. So the horses that start out at a very young age get it worse and worse and worse. It's important to remember you've got to try to separate the itch, the horse from the midge. Now, of course, there's lots of things that you can do with that, lots of washes. In the old days, we used to light smudge fires next door to the stable, and the smoke would go through and cover the fields and of course, we wouldn't get any midges go anywhere near it. So, but you put blankets on them, you can put rugs on them, all you like. But actually, I wonder if this is not the solution. You know, Prozac, not for the horse, but for you and me. It's much better for us. So we all relax, calm down, and try to talk to your vet about it. So I think it's just a bit of a facetious thing, of course, but they sometimes need cortisone. What about a few cancers? So cancers are important. We got 2 minutes to deal with each of these. So sarcoid is not a wart, it's a cancer. Now I ask people to do for the horses what you would do for yourself. You had a cancer on your body, what would you do? Would you go down to the supermarket and get some toothpaste and rub it on your cancer? Would you go to the herb shop and get a bit of turmeric and put it in your food? I don't think so. I don't think you would do that. What I'm asking people to do for all these 3 conditions that you see here is to consult your vet on all of them. We have strategies now to deal with this. And it's terrible when these cases get into this kind of state that you see here. This is a melanoma in the lip, carcinoma of the penis here, carcinoma of the eyelid here. These are becoming increasing problems. The carcinoma is becoming a problem for sure. In Australia, we see a lot of it. South Africa, we see a lot of it. But in UK, we didn't see a lot of it. Now we start seeing it. Why? Climate change. Sorry, it's impacting on horses as well. So, and that's the truth of the matter. So it's important. Sarcoids, very dangerous condition. It can become life-threatening. Easy to spot when they're in the beginning. They look like this, like this, like this, and they, as you can see, gradually getting worse along this platform here and along here. Which would you like to treat? Do you want to treat this, or do you want to treat this? You know, do you want to treat this, or do you want to treat this? It's a no-brainer, I would suggest. So please be careful. And remember that there are lots of sarcoids out there. There are lots of treatments out there. And what does that tell you? It's a difficult disease. Nothing works every time. See, look, the relationship to blood vessels. Do you see this? Blood vessels. See this here? See this here? See this here? All very bad. These are the things that matter. You can look at this later on. We're running out of time, but these, you can look at these later on the process here. But 40 different treatments, plus probably 100 junk treatments out there. If you wouldn't put it on your own cancer, do not put it on your horse under any circumstances. There is no universally effective treatment, and there is no cancer in the world in any species that has a 100% success rate. Use the best treatment first, and if it doesn't work, don't give up. You know, don't give up, because you can see what happens if you're successful. This starts out like this with a mismanaged sarcoid, lands up like this, cured. That's it. Okay, here's another one, goes from this, mismanaged, to this, lands up like this, being treated, and now this is where we are actually yesterday. So you can see in 3 months, we've gone from this to this, whereas it took probably 5 years for this to develop and about 3 weeks for it to develop from this to this with inappropriate treatment. So please be careful, okay? Prevention, be careful. Ask your vet for advice, you know, watch fly control over the summer. Melanomas are very common. Take advice immediately from your vet, please, okay? They can occur on non-gray horses as well. So please be careful. They always get bigger, they always get more difficult, and they always get more dangerous with time. Your horse has a melanoma, consult with your vet, okay? And if your vet doesn't want to do something about it, ask him, is this tumor going to get smaller, easier, and less dangerous with time, or what? Of course, it's going to be the or what. So do you want to operate when it's like this, or do you want to operate when it's like this? Do you want to remove the tumor and treat it here or here? Remember, these are very dangerous tumors that occur like this. Here's one inside the eye as well, as you can see. But they can go everywhere. They can be on the mane, they can be elsewhere, and they don't always have to be black, remember? Okay, and this is inside the guttural pouches. It's dangerous. Does it look dangerous to you? It looks pretty damn dangerous to me. They can be in muscles, they can be everywhere. Be very careful, okay? Very important. There's a vaccine for this, okay? Talk to your vet about it, very expensive. And doesn't stop the disease, but it slows it down. Last thing, just one slide more, if we can. Cancer affecting the skin. This is cancer, the ultraviolet related cancer, except on the penis. Well, horses don't lie on the naturist beach exposing their all to the sunshine, do they? You know, so it's hard to understand why this happens. And we know that there are different kinds of triggers for cancer, but notice that it's usually related to white skin, you see. So where there's pale skin, it's much more liable to it. And there are lots of different forms of the disease, require a lot of urgent treatment. This is a cancer carcinoma, very life-threatening, actually, and usually combined treatments required. Here's an X-ray showing the tumor having spread into the spinal cord all the way up here and into the lungs. Dangerous. Horse is dead. This is the horse here. So you can see it's not a good state of affairs. Prevention, you know, be careful with non-pigmented skin in the summer months. Ask your vet to check regularly in older horses on the penis, because the earlier stages don't look anything. Usually they have a sheath exudate. If your horse has a nasty, smelly sheath, get it examined quickly. Skin disease is common, easy to see, so don't overlook it. Just do for your horse what you would do for yourselves. No more, nor no less. Show your horse that you respect him or her by doing the right thing. Thank you very much.
Derek, thank you so much. As energetic as ever, but so much to focus on now, and we'll certainly come back to that in the Q&A. Vicky Nichols, who you'll know well, she's just sent you a brilliant video of lice sprinting, There you go. So that's one to add to next time's presentation. So what I'm going to do now, Derek, thank you so much. That was absolutely brilliant. So I'm going to share my screen, and before I introduce Claire, we're going to have the next, there we go, the next poll question. What is the most challenging skin condition you have had to manage? Now, we've obviously got other here because it may not be, but everything, a number of the conditions that Derek's just talked about: ringworm, mud fever, sarcoid, sweet itch, melanoma, squamous cell carcinoma. So whilst you are having a look at that, I will introduce our next speaker, which is Claire, there we go, who has been with the charity for a considerable amount of time, most recently now as our Chief Field Officer. She, as we keep saying, that she did fundraise for us on a bike ride from Land's End to John O'Groats, but what was most impressive, when she was training, she did the first half of her training for that, up to over 50 miles a day, on a mountain bike, and it was only when she found the joy of a road bike that she really began to enjoy her bike ride. So she's been a huge supporter of World Horse Welfare in her own time, as well as being an amazing employee in her daytime. And of course, the work of our field officers is so important to the work of World Horse Welfare. So before I hand over the baton to Claire, Basil, can you give us the outcome of the very quick poll? So not surprisingly, because we are in the season of mud fever is up there, but then sweet itch, sarcoids, ringworm, in fact they all, including others. So and interesting, 11% have never had a managing challenge, a skin condition. Well, amen to that, and hopefully tonight's presentation can help you prevent that ever happening. So without further ado, I'm going to hand over to Claire, who's just going to introduce a few case studies from a World Horse Welfare perspective around skin conditions. Claire, over to you.
Hi, Rolly. Thank you for the introduction. I'll just share my screen. Hopefully that will work. Did that work? Nope. Try again. Is that working? Or is it
you need to go off that and then click on your PowerPoint presentation to share that screen as opposed to your browser.
Ah, there we are.
Happy days.
Excellent. Got there in the end.
Well done.
Okay.
Excellent. You're there.
So as Rolly said, tonight I'll be sharing with you a few case studies that my colleagues and I around the UK have come across to help hopefully illustrate why it's so important to recognise those early signs of skin disease and to take the appropriate action. I thought it might be useful to share some identification tips and top treatment tips, and also look at some of the reasons why people struggle to get on top of skin disease to help you avoid those pitfalls. And like Derek said, by way of introduction, I think it's important to remember that the skin is the largest organ in the horse's body, and the condition of it and its coat are amazing indicators of the horse's general health. So any changes you notice shouldn't be overlooked. And also to remember that skin issues can overlap and one can lead to another if not treated. So it's really important that you understand what you're dealing with. So looking first at lice, the thing that most horse owners are relieved to hear about lice is that they can only live on horses. So they're species specific. And although they will crawl all over you when dealing with an infested horse, they won't bite you. Lice are tiny, but they are visible to the eye if you know where to look. And a vet once shared her top detection tip with me in the field, which is to put your hand against the horse's neck for a couple of minutes, and the lice will migrate to the heat of your hand and become mobile, and it makes them easier to spot. They do tend to favour horses with thick coats, you know, cobs and native breeds, and we see them throughout the winter and through into the spring. The good news is, though, they are easy to treat, but they are hard to get rid of. So whenever we come across lousy looking horses like Clyde here, if the owner is aware and doing something about it, 9 times out of 10 they tell us as field officers that they're using louse powder. And for powder to be effective, it has to make contact with the whole of the skin, or with the skin. And if you've got a thick winter coat, it's not easy to get sufficient coverage for the infestation to be treated fully. So at World Horse Welfare, we use Deisect and we repeat the treatment to catch any new larvae as they hatch. And we also recommend horses with heavy infestations and thick coats, clipping and hogging them, because that way we can be assured that the treatment is going to be applied effectively to the skin. You also, like Derek said, it's key that you treat all in contact horses and any that share the same equipment, because otherwise they'll just be passed from horse to horse. And you also, it's really key that you don't forget to disinfect all your grooming brushes, any equipment, remove all your bedding and thoroughly disinfect your stable. And the hair loss associated with lice is like what you see here on Clyde. It's patchy and tufty and often rubbed bald. I'm happy to say though that he made an amazing recovery and at Penny Farm, and he went on to be crowned the Reserve Champion Rescue Pony of the Year at Equifest before being rehomed on our loan scheme. Poor Buggy here though, he demonstrates just how the itchiness of a lice infestation can cause a horse to injure itself through self-mutilation, trying to relieve that itch. His red raw skin became an ideal spot for flies to lay their eggs on, which then led to fly strike. So fly strike's a really serious issue in the warmer months, caused when the fly eggs hatch into maggots and in infested wounds or on contaminated areas of skin. So a fly can lay up to like 250 eggs, and the maggots can appear within hours, so it really can become quite a serious problem very quickly. And especially when large numbers of them are present, they then start feeding on the flesh itself. And I've seen fly strike, like here, like what you see here on Buggy, on horses in the field, particularly on horses that suffer from leg mites. You'll get fly strike on the thickened folds of the skin on their legs. And I've also seen it on ulcerated sarcoids that haven't been kept clean. But despite the horrific start to his life, he too went on to make an amazing recovery at Penny Farm, and he was actually crowned Equifest Champion Rescue Pony of the Year, and he starred in his own professional photo shoot. The next case puts the spotlight on leg mites, but this poor mare called May also had lice and severe rain scald, and she was in poor condition. So leg mites are so common, particularly in feathered horses, that I find that some owners dismiss the signs and severity of the condition, and they just accept them as permanent guests in their lives because they think the breed is prone to them. The behavior of affected horses make it easy to spot the diagnosis. Like Derek said, you'll see them stamping their legs repeatedly or rubbing their hind legs on literally anything that they can get access to, whether that's gates, fencing, wheelbarrows, or you'll see them chewing at their legs or chewing at each other's legs. Leg mites cause horses great discomfort, and they really should be taken seriously because they're notoriously difficult to get rid of. I can assure you it is possible and it can be done. It's a lot like lice. You have to make sure that the product you use to treat them gets right down to the skin. So again, at our centres, their legs are often fully clipped right up to the elbow and to the stifle. You can see in one of these pictures here that May was initially only clipped to a sort of mid-cannon before later going on to be clipped fully and hogged in order for us to be able to get on top of her infestation. And again, like lice, most leg mite treatments fail because owners don't treat all their horses, the environment and the equipment simultaneously for the entire course of the treatment. So if you suspect your horse has leg mites, please do speak to your vet about it, because they can offer a course of injections, it's called Dectomax, which can be really effective if used in conjunction with topical treatments and environmental control. And I would also say to avoid stabling on straw. May, as I mentioned, also had horrendous rain scald all down her back, as you can see here. The image on the left is a different horse that came into our farm, but I thought it was a useful image to show what rain scald presents as. The bacteria that causes it is the same as for mud fever, which causes the hair to mat and form these scabs. And the scabs typically have these little tufts of hair attached to them sticking up, and I always think they look like little paintbrushes. So affected horses are often already in poor condition, like May here. but it's also horses who are immune suppressed and left out in wet conditions with little shelter. But any horse can get rain scald. It doesn't have to be cold for a horse to get rain scald, just consistently wet. And treatment is usually pretty easy if you can keep the area clean and dry. And I would also say to try and avoid rugging the horse by keeping it in wet weather if possible. But if the horse has to be rugged, I would get 3 or 4 lightweight cotton summer sheets and always place a clean one against the horse's skin with a turnout or stable rug over the top. And that way, any topically applied ointments will be kept against the skin by the cotton sheet, and then that can be washed each day, the cotton sheet. But in severe cases, you might need antibiotics and consult your vet. But I'm happy to report that May did make a full recovery. And as you saw in the last slide, she even attended badminton horse trials and had the honour of being the muse of our very first sculpture trail around the badminton estate, which helped us raise vital funds so that we were able to help more horses like her and Buggy and Clyde. That slide not moving forward. So mud fever next. It's a thing that's frequently reported to us as a concern of members of the public who often see horses standing out 24/7 in muddy fields, particularly those large groups of coloured horses with feathery legs. But the reality is that I see far more mud fever in privately owned competition and leisure horses who are constantly having their legs hosed off or washed. It robs the horse's skin of its natural waterproofness, and if it's not dried thoroughly, it causes the skin to chap, which lets in the bacteria that causes the mud fever. The heavily feathered horses have really good natural protection against the wet and mud, and so long as they have drier areas that they can move on to, allowing their skin to dry out, then they usually cope very well with our wet winter mud. But if your horse is prone to mud fever, it's important to keep its legs as dry as possible. And it's also worth noting that mud fever can lie dormant in the horse's skin and only become active when the surface of the skin has become compromised. It's worth looking at your land management if your horse is a regular sufferer. The equicentral system developed by Jane Myers is worth investigating as an alternative land management strategy because it prevents all the usual high traffic poaching areas in fields. But importantly, the earlier you spot any infection, the easier and quicker it should be to treat. So check your horse's legs daily. So ringworm is my least favourite skin condition to encounter in a horse because it's zoonotic and it can pass to people. It's easy to spot, as you can see here on Star, and it's not a worm, but in fact a fungal infection, much like athlete's foot. So the fungus spreads quite quickly, eating away at the hairs and causes these slowly widening bald patches that look scurfy and crumbly. From infection to you spotting the clinical signs, it takes roughly about 3 weeks, which I think is partly what makes it so contagious through a yard, and particularly if grooming kits and other bits of tack are being shared. It's really unsightly and uncomfortable, and you definitely don't want to catch it, nor does your yard dog or cat or any visiting children. But treatment is pretty straightforward using imaverol, but treatment must be repeated, and again, it must include all the equipment and the environment to be effective. It can live for months and months on wooden fencing and stable doors, so a really thorough disinfecting of all the surfaces is necessary with something like Virkon. It can cure itself over about 2 to 4 months, but it's really ill-advised to let it do that just due to how contagious it is. And so finally, I thought I'd share a couple of stock images of my favourite sweet itch rug, which is the Boet. And the key is to start, whatever rug you use, the key is to start using it as early as possible. So I would say in like mid-February to early March, before the weather warms up and the midges arrive and start irritating your horse. And even if that means putting the rug and mask on underneath your turnout rug still, because if you can prevent them becoming itchy in the first place, you're already winning the battle. And my second sweet itch top tip would be to keep your horse in a field away from where midges live, because they're poor at flying and they can't fly very far. So if you can keep your horse on a windy hillside that's not near any kind of marshy ground or water courses, undergrowth or trees, then and consider bringing them in at dawn and dusk when the midges are most active, and if you can safely put a fan in their stable, then that's really going to help. So in summary, act early, be thorough in your treatment of all affected horses and their equipment and the environment, and be mindful that it could be an indication that their immune system isn't working as well as it does, Cushing's being a classic example of that. But if in doubt, consult your vet about any changes that you see on your horse's skin. Thank you.
Claire, thank you very much, and that's a great sort of compliment to Derek's presentation there. Lots of questions, blimey. I'm not sure we're going to get through all of them. We'll do as many as we can, and it's brilliant to have people who've joined us from Germany, from Senegal, from Croatia, and lots of other places. Derek, to start us off, a question on Facebook from Rachel: is daily washing of a horse's leg with warm water too frequent?
In a word, yes. I think the important point is exactly what Claire said, you know, that the skin has its own bacteria. So I would rather not do that. And I think that one of the important points is to only wash the horse if you actually need to do so, for whatever reason. And if you are going to wash the horse, use the warm water wash system rather than a cold water wash. We know that happened for the Crimean war horses. They discovered that they wouldn't wash their horses with cold water because it made matters worse, not better. So a lot of the problems come from this maceration and the cold water hanging on there, usually with lots of chemicals and things which kill all the natural bacteria. It's too much. Yeah.
Brilliant. And someone's actually asked, why is cold water bad?
Because it doesn't, it causes the hair follicles and so on to close rather than open. So if you're washing the horse and you want to get some antiseptic or some soap or whatever it is at the hair follicle where the infection lives, you have to have it open. You have to have it open. Otherwise, it just closes it down. And so you may get a nice glossy coat on the first wash. That's fine. But that's not a cosmetic issue.
Yeah.
You can't have a cosmetic issue. You must have a therapeutic issue. Open the pores, get the stuff at it, and then get them rinsed off.
Brilliant. Claire, I think you've got a photo of this, so maybe you could share your screen. But Fran has asked if they can provide any insight into skin problems relating to extreme weather events, such as flooding. And we really haven't set this up because Fran's asked that question. And I think you've got a photo of a horse that was in a flooded field for over 3 days.
Yeah, if I just share my screen again, hopefully it'll work this time. Why is it not working? There, okay, and then move forward. Not that one, this one. Yeah, so this horse was reported to the authorities for being it got stuck in a river when the flood water had risen, but it hadn't been reported allegedly for 3 days. So by the time the horse had come out of the water, the damage was done really. But Derek's probably better placed to talk about what we're looking at in this slide.
Derek.
Yeah, well, what happens is that when you like you lie in a bath, you know, your nails go soft and your skin goes very crinkly and wrinkly. That's because the skin doesn't really like being soaked in water because it sucks up water into it, and that makes everything soft. And it also when you go in contamination with mud and all sorts of stuff like this, changes the bacteria on the surface of the skin. So all the bad guys survive, all the good guys go away. And so when you get into this position, you can see that there's a lot of damage to the skin where the surface of the skin has come away. And that's simply because you've soaked it. And now, you know, we all know that. You go to a chiropodist or whatever, a podiatrist or whatever, they soak your feet in water, warm water, usually with a few salts and things in it. And that makes all the rough skin on your heels soft. And it's doing exactly the same thing. And in this case, the horse is moving through flood water, you know, which is muddy, which has got coarse irritational granules and stuff of sand and stuff in it. And that's exactly what can happen, is exactly what happens. Yeah.
Brilliant. Thank you for that. Derek, quite a few people are asking about the prevention and management of malanders.
Yeah, malanders and salanders are old-fashioned names for a very common disorder amongst cob, heavy horse type horses. Not always only restricted to those, but largely it is. This is a what's called a nevus. Now, a nevus is like a birthmark. It's there at birth. You just don't know it. So this is a condition, Mallanders and Sallanders. Mallanders, which is a scaliness at the back of the knee, on the front legs, and Sallanders is on the front of the hock, right on the hock, and it's also a scaly, thickened area of non-flexible skin. And that's and what that is just a congenital abnormality. It's there because of the genes of the horse, and so you're never going to cure it. You're going to manage it. And the mistake that people make is that they panic when they see that. They take brushings and they find mites. Well, of course, the mites go there because, you know, that's where the food is cheap, easy, and accessible. Just like McDonald's for teenagers, exactly the same thing, where, you know, the mites go there. And so it's easy to find the mite. But remember what I said in the beginning. The most important thing is to find the cause of the problem and then try to establish a treatment for it. Very difficult to treat this disease. Much easier to manage it, to calm it down, keep it as calm as you can, and just relax, chill, you know, lay back and chill, you know. Oh,
you're on mute, really.
Apologies, I put myself on mute because a dog came in. Claire, quite a few people are asking about nutritional supplements as a prevention, obviously on skin conditions generally, but also some on specific skin conditions. What's your view on nutritional supplements?
We were talking about this earlier, and I much agree with Derek, really, that everyone's got their favorite thing that they'll swear by feeding and all the rest of it. But I wouldn't really like to say that there was one particular thing that's, you know, going to be some cure-all and fix everything. And Derek and I were speaking earlier and talking just about the benefit of oil as a supplement in feed. But yeah, I think people pin a lot.
Yeah, I mean,
but
yeah.
Sorry, go on.
There's
Derek.
a little bit of merit in putting. There's a little bit of merit in putting a little bit of oil in the horse's diet. It oils up the coat. Now, in the old days, we used to feed horses a lot of linseed, you know, and that made horses very glossy, very waterproof, very healthy looking. But of course, taking one step further back than that, they used to use an arsenic tonic, which made the hair glow. And that's why people who were being poisoned with arsenic usually had very healthy looking hair and were thought to be very healthy and then suddenly died. You know, we don't do that anymore, fortunately. But the important point is that if you can get a healthy skin, you know, the healthy skin wants to be healthy. It doesn't want to be sick, and it'll work hard to help you to keep healthy, provided you don't insult it. And that's the biggest problem of all. If you can't do any good, don't do any harm. And this endless washing, this fetish for washing of horses' penis, you know, and washing their legs and washing their backs, endless chemical use. It's harmful to horses. It may be okay for us, but it's definitely harmful for horses. Supplements, okay, not too much. Just they don't probably do much harm, but neither do they do any good. They're all expensive. Why not have a holiday and feed your horse a nice horsey diet, nice and healthy, and have a nice holiday on the supplements?
So less washing, save you money on supplements, a bit of oil once in a while, and Bob's your uncle. Derek, Emma has asked, what is your view on sun cream on white muzzles? Obviously, we talked about photosensitization. If worthwhile, should it be equine specific or is a human cream okay?
Yeah, my experience is that the human sun shields don't work. Right. They don't seem to work on horses anything like as well. And I think that there's a reason for that. And those horses which are liable to sunburn are often photosensitized horses, not just sunburnt horses. Sunburnt horses have a very characteristic look, usually on the muzzle, top of the muzzle. But if they start getting burns and inflammation as a consequence of of sunlight exposure on white-haired areas only, you have to be very careful, because that can be associated with either some poisonous plants directly or with liver failure as a consequence of ragwort toxicity in particular. So just be careful, you know, whenever you see sunburn on your horse, try to keep them out of the strength of the sun if you can, you know.
And Derek, sorry, yeah, brilliant. A couple of questions on sarcoids. Are they infective? Can they go from horse to horse?
I rather hoped you wouldn't ask the question because they're a very hot topic, actually. But there are lots of circumstances where we believe this has been an inevitability, where that has been the case as a certainty, where horses have been congregated together, no cattle, no sheep, nothing anywhere near, just horses. And one horse with sarcoid has come in, and then suddenly 5 horses have got sarcoid. So we believe that it is transmissible to some extent. Of course, it's related to the way in which horses themselves are related. So some horses, if they're very closely related, mother or fathers, family members of the horse, it may be more susceptible to the disease. And this is a genetic susceptibility. And so horses have a genetic susceptibility to sarcoid. A lot of horses have that, but only a very few get the disease. It is transmissible, and it is transmissible from site to site on the horse. Exactly how these two things happen is conjectural at the moment.
Okay, thank you. And then Vicky of the sprinting lice fame is asking you, would you discourage owners from putting Camrosa cream on sarcoids?
Yeah, it's inappropriate. Sarcoid is a cancer. And if you think that you can make some little creamy stuff made by something that I know not what, on a cancer and make it go away, it won't.
Yeah.
Now, set against that, of course, we all know that there are individual people who apply all sorts of things, turmeric, toothpaste, this and this and this. And in the internet, you'll find my horse had a toothpaste treatment and it got better. And everybody jumps on this. We now know why that particular case may just have triggered a little bit of a response that we're looking at now from a scientific perspective. But it's not cancer treatment, and cancer treatment has to be dealt with as cancer. I'm asking people to do for their horses what they would do if they had a cancer on their hand. Would you go to the supermarket and ask the spotty teenager behind the cash desk, where's the cancer? What would you recommend? No, you would not. Ask your vet. Your vets are fully qualified and capable of telling you what to do. I try to help vets as much as I can. And by doing that, we help owners. But like melanoma, like carcinoma, they're all cancers. Yeah. And cancer in horses is being very ignored. And it's a disgrace for us all, the profession, the owners, for everybody, society at large. It's been ignored completely, like it doesn't matter to horses.
Brilliant. Thank you. A very clear message there. Claire, Emma's asking, every year my horse develops mild mud fever. Am I better leaving mud on his legs or washing him off regularly with warm water?
Well, we've sort of covered the whole warm water and washing of legs and too frequent washing of legs. But, keeping the legs as dry as possible is the best thing. So brushing mud off when it's dry is preferred to lots of frequent washing.
Brilliant. Thank you. Derek, Melanie's asked a question on malanders. I think we've covered that. Corinne has asked several questions around sweet itch, around reliable allergy tests, whether other external means such as supplements or oils can impact. Do antihistamines help? Does ringworm vaccine help for sweet itch? Answering any of those?
That's a big panel of treatments. What that means, as you can see from all of these desperation measures, is that actually we don't understand the disease. And in spite of its commonality, the fact that a lot of horses have this disease, Icelandic ponies, Shires, Arabians, a lot of horses, breeds have Welsh ponies, they have sweet itch capability, and that's an allergic disease. Now that's the first thing. So remember what we said, take away the allergen if you can. Beyond that, the Boet blankets, these kind of things are separating the insect from the horse, you see. So that's why they work. But as far as prevention is concerned, or identification, people often ask about this vaccination system, either using the ringworm vaccine, which is a non-specific immune modulator, and it sometimes triggers a little change in the immune cells. It's not increasing or decreasing the immune process. That's nothing. Horses are very seldom immunocompromised unless they're ill. But if you do that, you change the attitude of the immune cells. That's the one thing. Then you can do the blood test or the intradermal skin test to prove that the animal is sensitive to it. And often in doing this, you find it sensitive to 500 other things as well. So then you don't know which is the thing that matters. circumstances dictate the diagnosis much more importantly. So once you've made that, then you can start to use, there's this thing called Cavalese, which is a material that is a vitamin supplement that you can give the horses before the season starts. So you start nice and early, about mid-February, and you keep them on that. It's called Cavalese, as I recall, and you can feed that in the supplement. And then there's a material also containing the same nicotinamide that you can put on the outside, and that sometimes causes a repelling of the midges. So repelling the midge, separating the midge, treating the itch if it gets bad. But remember that if you have an itch on your hand and you don't scratch it, it stays itchy for a very long time and becomes increasingly itchy. But when you scratch it, the itch goes away when you've got a horrible septic sore. You know, that's what we do. When you have a very severe itch, you scratch it till it's no longer itchy. And if we put a fence around a horse and stop it from scratching itself, I just wonder if that's not a little bit of cruelty in a way. And I strongly advise what Claire said: move the horse away from where the midges are. Put it on a hill, take it away from the riverbank, take it away from the forest, put it on a hill up in the mountain if you can, because there's no midges there. And
Obviously,
then the horse won't
challenging, especially if you're like me, if you're in East Anglia. But
oh yeah, very challenging still, nonetheless.
Catherine has asked, she's got a number of horses at her farm that show photosensitivity on the face and legs in the summer, shown by mud fever, sores and scabs. But they found that applying a strong fly spray prevents it, and therefore they've concluded that some sort of mite must have caused it. I wonder if it was common, it has affected a range of horses on their farm.
Where something affects a number of horses, you go back to that same basic principle again. You know, either it's a common infection or infestation, or it's a common toxicity or management business. Now, the most likely circumstance for that is the opposite way round. What is happening here, I believe, is that these animals will probably be eating a primary photosensitizing plant. And there are plenty of those. And your vet can come out and have a look, or you can get a botanist or somebody to come out, look for St. John's wort, look for a number of other plants that are, red clover, for example, is a very common photosensitizing plant that then exposes the horse. Dandelions is another one. Buttercups is another one. Buttercups are bad. Buttercups are really bad. Believe me, they're bad. And so then you expose that to the sunlight, they get the inflammation, and then the flies come, you see, to where the inflammation is. I think that's much more likely the way around. So if you've got buttercups, be careful. You've got dandelions in the field, be careful. You've got notable poisonous plants, primary things. They're not going to kill the horse, not like ragwort. If you've got ragwort, sorry, you have to take the ragwort out. Sorry, it's a no-brainer. But if it's got this, you just have to avoid the exposure to the plant, because to take the plant away, the disease goes. So that's really, I think it's more likely to be the other way around.
Yeah. Brilliant. Janice asked a question about Mallanders. We've covered that. Melanie's asked a question, are you still involved in sarcoids? You've certainly covered that one off. Emmy has asked about a cob that has sweet itch. It's never been managed in the past, and the info I got on him when I bought him was that he was just left in a field for 14 months. His skin is very sensitive and delicate. How can I help his skin to heal? Claire, from your perspective, what advice could you offer Emmy?
Yeah, certainly there's obviously all the general sweet itch advice we've given already about, preventing it in the first place, but there's some really gentle oatmeal washes. So I know that one of my friends has got a horse who has really bad sweet itch, which she manages, to be fair, but as part of the management, she gives him an oatmeal wash on his mane and keeps him really clean, like 2 or 3 times a week.
Brilliant. And Claire, another one from you. Maya's asked, do horses need to be brushed daily? I brush mine before riding or if he is muddy, but other than that, I leave him alone.
Well, I think people underestimate the value of a good old-fashioned thorough grooming with a good quality brush. I think it's one of the single most valuable things we can do for a horse to promote healthy skin. So I'm a big advocate of a good grooming.
Brilliant. Derek, Valerie's asked if you could say a little bit more about climate change and its impact on skin disease in horses.
Yeah, I think the things are changing, and conditions that we used to see in Africa much more, because I come from Africa, we used to see a lot of these things like habronema, which is a parasite that lives in the skin around the eye and sometimes in the eye, sometimes on wounds on the legs and elsewhere. It's a parasite that's transferred by flies. Never used to have those flies. We never had them. And the same applies to different species of midges that are coming in now. So they may bring in a lot of other diseases that we don't actually want. And so there are significant problems associated with climate change. Firstly, the high levels of rainfall, the muddy pastures, the things in winter, the extra warmth in winter. You may not believe that at the moment, but overall, our winters are becoming warmer. We used to get a lot of snow. Now we get it every few years. And up in Scotland here, it's quite noticeable for us. Up in the Highlands, you still get it, of course. And in 20 years' time, unless we pull ourselves together, we may be sunbathing in the Cairngorms in December. That kind of thing is going to change. And of course, ultraviolet exposure is a critical issue. And ultraviolet is usually filtered out by the ozone layer. So if you get ozone holes, depletion of ozone, high carbon dioxide in the environment, you will get more ultraviolet light. And ultraviolet light kills bacteria. I agree, that's fine. But it does a whole heap else. I mean, we know that if you go out into the sun these days, you get burned very quickly, as opposed to when I first came to the UK in the mid 60s, in the middle of last century. It was unusual to get sunburnt that quickly. Now you get sunburnt very quickly. It's very dangerous, rather akin to Spain. So everything's moving north. Everything's moving north, and we better be careful. Our horses need our help. They need help.
And then Claire Williams asked, how long should you home treat mud fever before getting vet advice? I guess that's rather dependent on what the individual situation is.
Yeah, I mean, if what you're doing hasn't worked, I think Derek said earlier, the quicker you get on top of something while it's small, and easily treatable is easier to treat. So if what you're doing isn't working, get your vet and tell them what you've done and time frame of it.
And I think that's just an important point that you raised, because if the treatment hasn't worked, don't say if a teaspoonful was good, then a kilogram must be better, because overstrength chemical is a really serious issue because it causes immense damage to the skin. So, if you get a wash, measure it correctly, get the right concentration, get everything correct. Don't say, oh, I'll just put in a little extra, because that is absolutely disastrous.
Brilliant. A few people have asked about pig oil, and Jane said here, my horse hasn't had it. Most of our horses are suffering of mud fever. My horse hasn't had it for 10 years, as I always use pig oil and sulfur to prevent it. But like today, it's so wet. What is the best thing to treat it with? I'm using Cetraben at the moment, Derek.
Well, as far as the prevention is concerned, if you can create a barrier between the mud and the skin that is relatively healthy. Now, pig oil, is quite heavy stuff. This is not trivial stuff to put on the skin of a horse, and it does create a barrier. So if you're able to look after the horse correctly, in addition to that, then you're putting a Wellington boot on the horse, I suppose, and that may help it a bit. But of course, it may cause damage as well. So once the damage starts, under those circumstances, very difficult to control. So be very careful. Best advice I can give is to be very careful. I'm a bit of a fan of clipping them out when they get very bad. I give them a so-called hot wash system that the vets know about. All the vets are using that at the moment to try to get rid of the bacteria inside the hair follicles, because that seems to me to be the key. Whereas if you just wash them superficially, you don't actually get the chemical where it's needed. And the pig oil is probably blocking these follicles anyway, so the bacteria can't get in there. So I can see why it's used. It's just that I'm not a fan of it, because actually the skin should be healthy enough to resist this on its own, if the circumstances are right, and if the management is right, and if the horse is healthy.
Brilliant.
So
Now
I think
we are after time, and I seem to be going backwards in questions. So what I'm going to say to Claire and Derek now, this is quick fire round, okay? Just what we want,
right.
quick fire.
One answer.
Claire, how often would you clean a horse's sheath?
So Derek said about that earlier. He doesn't recommend it at all.
Well, you clean it as often as you need when indicated, I guess, is what Derek was saying. But before you heard that, Derek, Claire, what would you be doing with your own horse?
No, only if it's presenting with a problem.
Yeah. Derek, is laser treatment the best treatment option for sarcoids?
No, it's one treatment. It's
Thank you.
applicable in some cases, but not in others.
Brilliant. Claire, what's your opinion on mud boots?
They have their uses, but prevention is always better than a cure. So if they're required, they serve a purpose.
Brilliant. Derek, what would you recommend? Would you recommend using Heavy Scrub for treating mud fever?
Yes.
And what are your thoughts on
Yes.
salty therapy for skin conditions?
What therapy?
Salt therapy.
Salt. Yeah. Salt is a mechanism for killing bacteria, just like you put meat in it. So it can be done, but be very careful because you can also cause a lot of damage.
And then Becky's asked, Claire, is clipping all the hair away the only way with heavy feathered horses?
It's the bestest way to ensure that the treatment is effective because it reaches the skin. So, I mean, that's certainly what we do at World Horse Welfare.
If someone wants to reach your vet, you can ask for a mechanism where you can avoid that. We have developed a mechanism to do that, but the vets know about it for the most part anyway.
Brilliant. Derek, does garlic added to the feed help against flies?
No.
Good. And another one for you, Derek. Is there a link between Cushing's and skin rashes at molting?
Yes. Yes, there is. The skin is compromised, immunocompromised. Lice, parasites of other sorts, lice, mites, and bacterial infections are very common in horses with Cushing's disease. Clip them out. Get rid of the hair. Doesn't matter if they shiver. Don't worry about a horse shivering. Get rid of the hair quick as you can in the spring. Yeah.
Brilliant. And Derek, final question from Heather: can a horse be allergic to its own sweat?
Yes.
Well, there you go. If we were doing on results, then we've managed to tip the balance. We've answered more than the outstanding questions list. I'm really sorry for those who've asked questions. I hope there's been a lot of overlap, so I hope we've answered the majority of them, and I'm sorry if we haven't. But just to reiterate, the webinar will be available on our YouTube site later this evening. And just to sort of do a headline for our next webinar, which is in a fortnight on the February 3rd, and that's building your horse's strength through groundwork. And we'll put a link up to that shortly. So very shortly, I'm just going to ask Claire and Derek to provide just some final thoughts. I mean, I say at every webinar, we covered a lot of ground. We sure have covered a lot of ground tonight. Never have we had so many questions. So thank you so much to everyone for those. It's been a really interactive session. Claire, having heard everything we've heard tonight, what would your final thoughts be?
I sort of touched on them earlier. Act early, before things become a bigger problem. They're much easier to fix. And don't underestimate the value of a good thorough bit of elbow grease and regular grooming. It helps you spot problems and promotes good healthy skin and circulation.
That's a really good message. I love that. Derek, final thoughts from you.
If you're worried about the horse's skin, consult your vet. Try to make that relationship work for you. It doesn't matter how trivial the skin disease is. Ask. And if things don't look right, then remember that if it doesn't look right, it probably isn't right. And if you treat something and it doesn't work, declare it straight away and ask for help so that we're all on the same hymn sheet. We can only get positive results when we have all the information available to us, both you and us. And so we need to share our knowledge with you, and you need to share the information with us so that we can help you best. It really pays in the end.
Listen, thank you so much. There's been messages from the US and many other countries who've joined in. I'm very aware when we have sessions like this, you would think, well, why on earth would you own a horse if there's so many problems? But I hope tonight has really been about the simple message, about the simplicity of it. And if we adopt a simple approach, a methodical, simple approach, and especially, as Derek says, do unto your horses as they should be done. Our obligation to them is, it really is. But hopefully tonight has provided you with some good food for thought and will help us all be better horse owners in the long run, which is of course what we want to be. So thank you so much for joining us. Thank you again for all your questions. Apologies again for not being able to get through all of them. And of course, a very, very sincere and heartfelt thank you to Claire for joining us this evening. And of course, Derek, in your snow-filled paradise up in Scotland. Thank you so much. It's been great to have you. We'd love to see you again on a webinar in the near future. But before that, as I mentioned, the next one is on February the 3rd. Please do join us then. In the meantime, please take great care.